Good evening. Welcome to another edition of Sound Health on Lagos Television. I am Olasumbo Modupe. Sound Health airs every Tuesday at 6:30 p.m. and we enlighten members of the public on trending health issues from around the world. Today we are looking at pelvic inflammatory diseases. Many women experience this condition and they do not even know how to go about it. Take a look at this health condition so as to reduce risk factors for other diseases. Stay tuned. The conversation begins after this break.
The program is a 3-year program and it involves training of health workers, providing mosquito nets and nutrients for malnourished children. We have also supplied equipment to primary health centers, as well as providing media information to the public. We believe that healthy mothers will produce healthy children and our nation will also be healthy.
Let's talk about nutrition in pregnancy and nutrition in children under 5. What is nutrition in pregnancy? Nutrition is everything that a woman needs for the growth of a baby. And it comes with diet. With proper diet, a child is expected to grow well in her womb, and then she needs that as the child is growing. For a child that is growing, a lot is going, and then a proper meal has to be produced for that child to grow properly. A child needs to be breastfed first 1 hour of birth, and this is called early initiation. During this period, that child has the advantage of taking the first milk that comes out, that is called colostrum. That's acting as the first immunization for the child. It happens for the first 1 week. Every child is expected to be breastfed for the first 6 months exclusively without adding anything, no water, no drugs. And also proper breastfeeding also help with easy expulsion of placenta and proper evolution of the uterus. After 6 months, there's a iron gap, and that's why we actually also advocate for proper complementary feed with continuous breastfeeding till the child is 2 years. And in breastfeeding, it is important to note that there are 2 kinds of milk, fore milk and hind milk. And if a child does not enjoy both milk, that child looks as if he's not well fed. So the timing of breastfeeding has to be long enough for a child to be able to benefit from both the fore milk and the hind milk. Any child that has been breastfed for the first 6 months exclusively is expected to continue breastfeeding and have complementary food, and that is family meal. The proper and appropriate complementary food must have adequate diet. It must be available, accessible, affordable, and what is advocated is the food around the community that the child can join with the family meal for that child to have proper growth. A proper diet gives a proper growth, and a proper growth is a healthy future.
The program is still Sound Health on Lagos Television. Join us via Zoom this evening to look at pelvic inflammatory diseases, how to reduce the spread in women, as well as management of this condition, is Dr. Chukewmeka Odiega. He is a consultant obstetrician and gynecologist with Iatros Specialist Hospital. Good evening, Dr. Odiega, and thanks for always obliging us.
Yeah, thank you.
All right, Dr. Odiega, tell us, what exactly is pelvic inflammatory diseases?
Okay, pelvic inflammatory disease, otherwise known as PID, that's the acronym for it, refers to an ascending infection of the upper genital tract, okay, which involves what is referred to as endometritis, that's inflammation involving the lining of the womb, salpingitis, that is the tubes, ophoritis, which are the ovaries, and parametritis, which involves the tissues that are supporting tissues surrounding the womb. Okay?
What causes this condition in women?
Well, normally the cervix acts as a barrier. That's the uterine cervix, acts as a barrier to prevent the ascension of organisms from the vagina. So when there's a break in this protective function of the cervix, it now allows certain organisms from the vagina to ascend up into the womb, the tubes, and the ovaries. So, and this can happen commonly following sexually transmitted infections, especially chlamydia trachomatis and Neisseria gonorrhea. Okay, so when these organisms are in place, they now predispose the woman to developing pelvic inflammatory disease. They now allow organisms referred to as commensals in the vagina to ascend up. Okay. Apart from sexually transmitted infections, other causes could include placement of IUCDs, that's intrauterine contraceptive devices, use of carrying out certain procedures such as hysteroscopy and even dilatation and curettage, which can be used for management of miscarriages.
Dr. Odiega, let us know the symptoms. How can a woman know she's experiencing this condition before we look at if there are other types of this condition?
Well, common symptoms, especially when you have acute PID, okay, include low abdominal pain, which is usually bilateral, means on both sides. And a lot of times the onset of the symptoms may happen soon after the menstrual period for that month. There could be on a vaginal examination, when you present to the doctor, the doctor may notice something called adnexal tenderness, which means tenderness or pain is elicited when the doctor examines the sides of the womb. You might also have something we call cervical excitation tenderness, which occurs when the doctor moves the cervix around during the vaginal examination. Other features, these are the cardinal features of PID, but other symptoms or signs may also be present. So, for instance, the woman could be complaining of intermenstrual bleeding. Okay, that means bleeding in between menstruation, postcoital bleeding, maybe bleeding after sex, could be complaining of fever, could be complaining of abnormal vaginal discharge, could be complaining of malaise. That's a general feeling of being unwell. So these are some of the common symptoms and signs.
Okay, can a woman experience other risk factors according to this? But before we look at that, are there different types of PID? Is it just an umbrella name for other inflammatory diseases or infection in women?
Well, first of all, PID could be acute or chronic. That is depending on the duration. Okay, usually for most illnesses, when you have illnesses that last for less than 6 months, you say it's an acute presentation. And if it lasts for more than that, you start saying it's a chronic presentation. Then apart from that, when I was trying to describe PID, I mentioned that there are a number of places that it could affect. So you could have them either alone or in combination. You could have it affecting the inside of the womb, that is endometritis, or you could have it affecting the fallopian tubes, what is called either an endo or exosalpingitis. You could have it affecting the ovaries. You could have it affecting the parametrum, because that's the supporting tissues around the womb. So all these areas that may be affected come under the umbrella of PID.
All right, Dr. Odiega, thank you. Are there other factors that can increase our risk of getting this disease, apart from through sexual intercourse?
Yeah, apart from sexual intercourse, as I've said, anything that reaches the cervix, okay, anything. So, for instance, putting in instruments okay, maybe you visit the doctor for one procedure or the other. So putting it instruments into the womb can actually, through the cervix, can actually predispose. So things like, as I said, hysteroscopy, okay, which involves, is a minimally invasive form of surgery, where we pass a long tube inside the womb through the cervix that has a camera and a light attached to it, so that you can see the inside of the womb. So in the process of doing that, the woman at risk can actually develop a PID. Or even you are trying to put in some methods of family planning, such as the intrauterine contraceptive device, okay? Or you are even doing procedures either for termination of pregnancy, maybe for miscarriages or something like that. So D&C, or even manual vacuum aspiration. And that's why in contexts like this, it is usually advisable to give prophylactic antibiotics empirically to prevent the development of PID after. Another risk factor could be the presence of a kind of, well, we can call it an infection, but it's not really an infection. It's called bacterial vaginosis. Okay? So when you have bacterial vaginosis, usually they produce an abnormal vaginal discharge, offensive discharge, fishy discharge, usually not associated with any itching or anything like that. Such women are at higher risk, okay, of developing PID.
Okay, on this show now, I would like you to dispel some myth. I don't know if it is an accepted myth. You hear women oftentimes say, I'm having infection, I'm having toilet infection. Does this fall under this category, and is this really true medically?
No, first of all, it doesn't fall under this category, because a lot of times when women are talking, or in my own experience, my own limited experience, when a lot of people are talking about toilet infection, they're actually talking about a yeast infection, candidiasis, okay, which produces a whitish, non-offensive vaginal discharge associated with itching of the private part, maybe associated with burning sensation when they are passing urine. So candida is not a part or a type of PID, okay? It produces a discharge, but it is not PID. And also, PID has certain sequelae, that are things that can happen after developing acute PID. For instance, they are more at risk of having tubal factor, that is damage to the tubes. So they have tubal factor infertility, more at risk of having chronic pelvic pain because of adhesions that form inside the pelvis, and also the risk of ectopic pregnancies. So none of these things are associated with candida infection. So that tells you that there's really no relationship between the common toilet infection in quotes and PID or its sequelae.
All right. When left untreated, are there complications? Because you mentioned that there are also acute, there are also chronic conditions. Now, are there complications when left untreated or not
Yes,
managed properly?
there are complications which I have mentioned briefly. The commonest complications are, as I said, tubal factor infertility in about 20% of cases. Chronic pelvic pain in about 20% of cases, and ectopic pregnancies in about 10% of cases. So these are the common complications. There are a few others. For instance, if left untreated, it could develop into something referred to as a tubo-ovarian abscess, which is like a collection of pus, which affects the tube and the ovary on one side. It could lead to something they call the Fitzhugh-Curtis syndrome, where you have adhesions, that's scar tissue, happening in distant organs, sometimes being found even in the liver, So there are complications.
Okay, so let us quickly look at prevention. as well as treatment. Can this disease be prevented as well as managed?
Well, in terms of prevention, of course, the commonest risk factor by and large is still sexually transmitted infections, okay? And especially chlamydia and gonorrhea. And these infections, especially in women, up to 60% of women will not produce any symptoms or signs. So they'll just be silently there causing damage to the reproductive organs. So if we say we want to adopt a policy of waiting till the woman has symptoms or signs before we start treating, that will not help in preventing PID. Okay, so prevention, primary prevention, first of all, health education, especially to vulnerable groups, especially the teenagers, so sex education, counseling them on abstinence until when it's is socially and culturally and religiously acceptable, use of certain barrier forms of contraception, especially the male condom, okay, these are some measures. And then, especially when we are looking at other means of contracting PID, which I've mentioned, the use of prophylactic antibiotics whenever such procedures are being carried out. Okay, so for instance, if we are doing D&C or an MVA, she should be given antibiotics that will cover for the common organisms that are responsible. For instance, in the United Kingdom, anybody that has any invasive procedure, D&C, even HSG that is commonly done for infertility, they will be prescribed prophylactic antibiotics, especially doxycycline or azithromycin to take care of chlamydia infection. Okay, so by and large, these are some of the ways of preventing PID.
So in plain terms now, when left untreated, a simple infection can lead to other scarring, can lead to a lifelong condition that cannot be treated if not handled early enough.
Yeah, yes, that's very true.
Oftentimes you hear people say, if you're treating a lady and you are not treating the spouse, it means the infection is still going nowhere. How true is this medically?
Yeah. Yes, that is very true. The treatment of PID is not complete without something referred to as contact tracing or empirical treatment of the partner. A lot of these women who have acute PID, or a good number, may have multiple sexual partners. Okay, so that is where contact tracing now comes in. Okay, that we need to trace the partners and they need to be treated for PID. Or if we can't trace them and then carrying out testing on them, we need to prescribe empirical antibiotics. That's the same kind of antibiotics the woman is on. And the reason for this is to prevent reinfection. Okay, because the woman, you can finish treating the woman, the infection goes away, she goes back to that sexual partner and it reinfects her. And then we have issues now with antibiotic resistance and all that when she gets infected again.
All right, your final words as we wrap up this segment, Dr. Odiega.
PID is quite common in our environment here. How common it is difficult to say because a lot of cases actually go unreported, and later they present with the complications that follow PID, and then we start talking about managing these complications. So if we can, give good health education, especially to the vulnerable groups, the teenagers especially, that will go a long way, and providing them, whether we like it or not, sex education is something that should be given, okay? Should be taught in schools, Even parents should feel comfortable talking with their children when they get to a certain age, and things like condoms and other forms of barrier contraception should be made readily available for those that cannot abstain.
All right. Thank you so much, Dr. Odiega, for that clarification. We really appreciate your time. We have been talking about pelvic inflammatory diseases, how to prevent, how to manage, as well as how to treat. So thank you so much, Dr. Odiega, for your time and expertise.
Yep. You're welcome.
Sound Health continues with trending health report from around the world. Please stay tuned. The program is still Sound Health on Lagos Television, and we have been discussing pelvic inflammatory disease. Please note, toilet infection is not pelvic inflammatory disease. You need to get proper diagnosis before you know the kind of disease you're treating. Visit the nearest health facility to ascertain the medical condition. Do not self-medicate. This is why we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.